you have to know your breast. All women have to know their breast.
Yes.
I'm about 60 plus now.
Oh, wow.
But I just look beautiful, right?
Very, very.
Yeah, you look very young. Yes.
Because they abandoned me, my family, my children, everyone, even the man who was also playing with this breast. So no woman should run away from this disease. It's not a dead sentence. You come out the way I have come out. I'm not a hero. Yes.
Yes. That's why you're here.
Because there are some girls, when you touch their breast, it's very soft. There are some other girls, when you touch their breast, it's very firm already.
And men, they have not stopped we are not stopping breastfeeding them. But they are running away from us. Why? And you said if I should even remove my dress anywhere, I'll do it.
And show everything serious.
Wow. But doctor knew me. I'm Raheema, yes.
Doctor, is it true?
That's me.
An experienced hand is the difference. So go to your doctor or come to me.
So obviously,
so I'm removing the artificial breast for you people to see. Yes. I cross the bridge, no more pains, the sun will shine, I cross the river, and I will never be unhappy again.
Wow.
Stay by plan, across, stay by plan. All the boys, all the girls, for stay by plan. Stay by plan, stay by plan. All the boys, all the girls, for stay by plan.
welcome to another episode of Stay by Plan. We've had so many things going on this past few weeks. Zoo, how have you been feeling?
I've been okay, stressed, but we're managing Accra. Yeah.
I think at least my highlights so far has been the 3 Music Awards, and I was so excited personally about my fit because it was from Christy Brown. And yeah, shout out to Christy Brown. She really has some really amazing pieces in her flagship store in Osu. And yeah, don't you think my fit 8?
Oh yeah, it was amazing. And also shout out to a champion clothings at Ashale Butray. He also got me. I was looking fresh, guys. It was not a joke. So yeah, shout out to a champion clothings.
Yeah. So yeah, if you want the same dress that I was wearing, it's called the Dion Silver dress. So make sure you check the Christy Brown website. And yeah, you heard it here first. Okay. So Charlie, as you guys can see, there's a very special guest here with us.
Yeah.
And I don't know if you are deep and you can see that there's like pink all over the place. Like we are trying to hint something to you.
Yes.
And I hope by the end of this episode, you would get all the hints that we are trying to hint you. So do you want to do the honors of introducing our guest?
Yes, so I'll let her introduce herself, but I'll introduce her small and she should continue.
Small.
So we have the lovely Raheema here. She's a breast cancer survivor. Ooh. Yes. So please, Raheema, tell us more about yourself. Who are you? And welcome. Yes.
Welcome.
Yes. Thank you both. My name is Raheema Quaye, as you mentioned.
Yeah.
Raheema Quaye is my name. Yeah. And I'm a breast cancer survivor. Both breasts, not one. Both.
Oh, wow.
That we all normally call it bilateral mastectomy. Yeah. And I want to share my experience with you, what I went through. For each and every one. Anyone you are a woman or even a man, you have to learn something out of it.
Yeah.
Yes. Because early detection and prompt action saves life.
Yeah.
Yes.
Yes. Yes. I'm a woman normally when bathing. I use the soap foam to just screen my breast. And one day doing that, I detected a lump.
Oh, wow.
And I told my elderly sister. And she also introduced me to a friend. And this friend led me to Eba Clinic.
Oh, wow.
I was there for more than 3 years.
3 years?
Yes. More than 3 years.
So, Raheema, how old were you when this was happening? Do you remember?
Around 40
years old.
Yeah. So I was there for 3 years. I've been having the scan, ultrasound every month. Doctor said everything was coming down. So I I thought that time I didn't know anything about breast cancer and related issues. Yeah. So I was there, and the pains that I went with was down. So I thought it was all over. And I was one day heard about a breast screening. I said, no, once I feel that I was okay, I have to go and then to have this breast screening. So I went, it was organized by Dr. Beatrice Yafi at Amasama. So I went, and then I was being screened, and they told me that, hey, Raheema, there is still a problem, big problem in the same breast. And so they give me a referral to their hospital. But you know what happened? I didn't go. I went back to where I went.
No, yes. wait. This one I have to pause your story. Raheema, why didn't you go? Honestly.
I wanted to put those people right, that they didn't treated me well. So that's why I went there. And when I went, you know what happened? The doctor said, oh, we left some medicine to be given to you. So now you don't worry, we are going to use that medicine.
Oh no.
And I was given the medicine for about 3 months. And I saw that the breast was changing another color altogether.
Oh no.
Changing into black, shining, and then the nipple was shrinking inside.
Started to sink
inside. Yeah. So I said no, I have to go back to Dr. Beatrice Yafi's place. Yeah. So I went. When I went, I did the memo and then the biopsy. The result came, it was cancerous. So I started the chemotherapy, as you all know.
Yeah.
And the chemotherapy, you know what happened when you started your hair, wherever hair.
Everywhere, your eyebrows, everything, lashes, everything.
Gone.
Wow, the private part.
Gone, everything.
Wow.
So, Raheema, I want to just backtrack before you continue the story. Just more of family, friends, even before you found out about the cancer. What was everybody's reaction to just, okay, we all know Raheema has this problem with her breast, it's been hurting her. Nobody had anything special to say or...
Yes, miserable. Horrible. That's what I'm going to say. Because they abandoned me, my family, my children, everyone, even the man who was also playing with this breast. You run away.
I was about to be very emotional and she has made me laugh.
Oh my God.
So so they're running away. Was it after they found out that it was cancerous, or even from the herbal medicine time they had already abandoned you?
No. For the herbal medicine, they didn't abandon me. But when I went to Dr. Beatrice, I came out and told them that this is what was happening. And they said, no, by all means I will die.
Oh, no.
And that's it. So the money that they will help me with, they will gather it when I'm dying. They will use that to make my funeral. So that's all.
So from the time that you noticed the first lump to the time you went to Dr. Beatrice's place, how many years was that?
It was 4, 5 years going. Yeah.
Wow.
Yes. So it had to reach the advanced stage.
Because when you came in, one of the first things you said was early detection saves lives.
Yes.
So based on your experience now, do you think when it happened in the beginning, if you had gone to like the doctor earlier, it could have been resolved?
Yes, because there are some people who they are survivors. They still have their breast because they came in early. So you can do the chemotherapy all right, but your breast will never be off. It will be there.
Understood.
So that's why I said early detection saves life.
Yes.
Wow. So, the chemo. So let me ask about chemotherapy. How painful is it? I've heard it's painful.
It's not all that painful, but painful. Because it's like you have gotten malaria. Well, you know, when you got married, you see the way it is. You don't feel like eating, everything is just not sweet in your mouth, when you becoming dizzy and what. Some people will be vomiting. Yes, vomiting is also painful, right?
Yeah.
When you started vomiting, all your lungs will be, it's not easy. But for me, God lost me, so me for vomiting, I didn't have any vomiting at all. I was strong. When I was going with the chemotherapy, I was very, very strong.
No, we thank God.
I worked with it because I told God that, God, you are the one who brought this illness. So you have to help me out. Because each and everyone has abandoned me. If you also abandon me, what will I do? So you have to stand by me. And so I fought a great fight for my children, for the nation, and for all women.
That's right.
Because talking today, I'm always proud of myself. Yes, I'm proud. Because there are so many women who are hiding. They don't want anyone to see that they are a survivor for breast cancer. But to me, I've left breast cancer out of the basket. For everyone to know that we don't know the cause. But there is a medicine that can cure breast cancer. So each and every one has to know that there is a cure for breast cancer. You don't have to feel shy. We have to come out and fight for our rights. Women, because when you educate a woman, you educate the whole nation. So no woman should run away from this disease. It's not a dead sentence. You come out the way I have come out. I'm not a hero. Yes.
That's why you're here. Yes.
So Raheema, right now, obviously you are alive, you are well. Your family, the money that they were saving for the funeral, no, it's not necessary anymore because you are still alive. So what is your relationship like with them now?
For now, we are more than. They have now understood that breast cancer is not something that you get, you are going to die, or whether you join me, you get breast cancer. No. So now they have now understood what breast cancer is all about.
So from their perspective, it was more of, because they didn't understand what was happening, because of fear and ignorance, they shied away from you. But now that things have gotten better, they've understood. So we are now more than. Yes, they are even bringing people. We have survivor babies in our area over there. So my family, they have all joined the survivor babies. That's great.
So that's it.
And then
because for men, some, it's a few, and that's all I would say few, because mostly they always run away from the woman. And if a woman is sick and the man is beside the woman, if the morally, the sickness will just go.
True.
But running away also is another big problem. And men, they have not stopped we are not stopping breastfeeding them. But they are running away from us. Why? Until the day they will die.
It's true, when they hear there's breast cancer, no, they will run. But before that one, they were there.
They were there. They were even sleeping in the middle of the bed. There are so many who sleep there till morning. That's it. You have nowhere to go. You have to stand for them.
Yes. That's true. That's
so fact. They also have to stand for us when there is sickness in the breast.
Yes.
They don't have to run away.
True.
Very
because
true.
my husband run away.
Has he come back?
No. And if he come back, I will never marry him. That is life.
Yes, I support that.
Yes, that is life.
You should have been there.
Yes. The time I needed you most. When you marry, say for better, for worse. When it's worse, you run away. No, for better, you come. No, go away.
She said no, go away. Yes, this is it.
So how old are you now? You said you had the first.
I'm about 60 plus now.
Oh, wow.
But I just look beautiful, right?
Very,
you look very young. Yes. So your journey up to now, that's about 20 years since.
It's almost 18.
Okay,
18
okay, thereabouts. Okay.
So I got the first.
The story.
Yes, the first. I just survived 15 years for the left side, and I defaulted. you know.
Mm.
And one story that I always wanted to say, the time that it will be the time for the mastectomy, for the surgery.
Yeah.
I was from the ward to the theater, and I told doctor, I will never do this mastectomy. I will die, because people have been telling me that when you remove your breast, you are going to die. So I will never do it. Doctor said, hey, you have to say yes. Okay. I was sent back to the ward. From morning, doctor was at the theater waiting for me to say yes.
Wow.
From morning till 7 p.m.
Wow.
before I said yes. And I was brought to the theater, and the surgery was what? Done. That is where I survived this breast cancer, because all my family was they all abandoned me. Yeah. So doctor was there for me. Doctor was my second mother.
Oh.
May God richly bless her and give her long life.
Yeah.
She was serving me.
Mm.
Wow. She would come to the the ward and come and ask me what I wanted to eat. And she would provided it for me as a second mother. So that's all I saw, and that's what helped me to achieve my goal. Yes. Because I was there for a long time, and she was giving things for me freely. As I don't know what to say. So today, and so I survived that left breast for 15 years, and I divorced. I thought it was all over, so I have not been coming for checkup and treatment. Yeah, I thought it was 15 years, so it was all over. So I defaulted, and then I came back again, and Dr. Ben was the one who did the biopsy for the the right one.
So Ben's in the house, guys, behind the screen. Shout out to Dr. Ben.
Yes. So the biopsy was done, and because I knew something about breast cancer, this was the first. It was stage 1. So for that one, after the biopsy was done,
Early detection.
Early detection, and then after the surgery, after surgery, some people go for the radiotherapy. Why? But I didn't go because it was actually reached a stage of going to the radiotherapy. But it was 3 years now that I also survived the right breast.
Okay. So I want to ask doctor a question just off camera. So she said something about defaulting. So does that mean that once you've had breast cancer before, you are almost always at risk of getting it again? So maybe you have to actively always be going to the hospital, checking. What's your mind on that? So just to highlight on what Doc said, he basically said that yes, and very simply, if you've gotten breast cancer before, you are more likely to be able to get it again in your other breast. So once you've gotten it before, you definitely have to continue going to the hospital, make sure you are doing your scans, make sure you are doing your self-examinations, you are making sure that the doctor too is checking. Because maybe if you decide that, okay, I'm fine, and then you leave things for maybe a year or two and something happens again, you would have an issue. So in as much as you are a survivor, you still have to keep checking to make sure that there's no new developments with respect to cancer. I hope I got it properly.
Yeah.
Okay.
Good job.
The woman also, you have to know your breast. All women have to know their breast.
Yes.
Because if anything occurs in it, then you just find it out.
Yeah.
Please expand on these points. All women have to know their breast. Yes. How about as a woman? How will I know my breast?
You have to know.
The breast, one is bigger than the other.
Okay, so did you know that?
Yeah, no.
Hey, Mr. Zoo.
Oh, I saw it in a science book.
And you know the way God created the lamb, the breast. We have the natural lambs.
Okay.
That are very soft. When you are doing your own self-examination, you see they will be just walking.
They'll be moving around the breast.
Yeah, they will move around the breast. But the one that is the poisonous, doesn't move.
It's hard and it's just there.
Yeah.
Okay.
So if you know your breast, you know that when something bad comes in, you just see it.
Okay.
So that's it.
So guys, just for the record, your boobs, one would be slightly bigger than the other.
Bigger.
If you have a you can see that the one is bigger than the other by far, please go to the hospital. That means that there's probably something going on in one of them that needs to be checked. So the difference is very slight. You only sometimes if somebody checks, they might not be able to see, but because you know your body, you know that there's a slight difference. So that's just like by the way. Doc, with respect to the lump, how would you know if a lump is a normal lump?
Or
And
a
then how
cancerous
you
lump.
know if a lump is not cancerous? Because I remember very vividly one of my friends, I'm sure if she watches this, you know I'm talking about her. One of my friends, when we were in JSS, she developed a lump in her breast and she had to go and do an operation, but it wasn't cancerous, but they took it out anyway. So how do you know the differences? Okay, there's nothing like a normal lump, guys, first of all. So she didn't have a normal lump. Okay. So this one, you repeat what the doctor is saying.
Yeah, don't worry, I'm listening.
Okay. Okay, Doc, pause. Wait, let Zoom translate what you forget. Okay, Zoom.
So, first of all, you have to know your breast, like we've said already.
Yes, know your
Be
breast.
very familiar with your breast. And when you're doing your tests and your self-checks and so on, when you notice, or if you notice a lump, and there are three feels, three feels, it says soft. You can use your lip, because some people are only listening, some people are not even watching. So, if you touch your lip,
That's soft.
a soft, similar to a soft feel. If you touch your nose, similar to a firm feel. And if you touch your forehead, that's hard. So usually the cancerous lumps are hard, like your forehead. And then the benign lumps are firm, like your nose. And then soft is usually just the tissue or just fat within the breast. So,
However, I think this is so important, especially for the whole self-examination thing, because if you are not doing self-examination, how would you even know what a soft is like in your breast or a firm is like in your breast? I feel like it's still going to be very subjective or unique to people.
I guess that's why you have to be checking.
Yeah, that's why you have to be checking, because there are some girls when you touch their breast, it's very soft. There are some other girls when you touch their breast, it's very firm already. So if you are not actively touching your own breast to know what is normal and what is not, you will not even be able to tell like what kind of lump is this. And so Charlie, please be pressing yourselves more, girls. Make sure you check.
Okay, I have one more question before we come back to Raheema. So, how quickly can a lump appear? Because if you're doing, I mean, of course, we should do is
Like
monthly
today and tomorrow,
or
can it just go boom?
yeah. How fast can a lump appear? Please repeat what he said.
Hey, Charlie,
Should have given you a mic.
Charlie.
Should have given you a mic.
So, what was your question again? So that I know how to
I said how fast can it appear?
How fast do the lumps grow? So basically what Doc was saying is that some of them can be slow and some of them can be super fast. It depends on a lot of factors such as pregnancy, hormones, just different things. For example, someone who is pregnant may have faster growth as compared to someone who is not. And then also with the cancerous type, they grow much faster than the benign types. That's basically what he said. And it's always good to just keep checking as yourself monthly, because maybe if you check it this month, you might not feel it because it was small. But if you check it next month and if it has grown, touch wood, none of us will have it. But if it grows, then maybe in the next month when you touch it, it would be there basically. So we just have to always keep checking and always make sure that we report anything, no matter how small it is, to the doctor. Because it's better for you to go for an experienced hand to check and say there's nothing wrong than for you to assume that, oh, wait, yeah, it's just normal. It's just normal. Okay, so back to Raheema. Yes, so Raheema, how did you feel when you realized that you had gotten breast cancer again? Did you feel like God isn't being fair to me? Like, what was your, is it my, like, it's my fault, I should have gone to the hospital? How did you feel about the whole thing?
It's my own fault.
That's how you felt.
Yeah, because if I've been checking, it would not happen that way. But I didn't, because I thought it was 15 years all over. So that's it. So it's my own fault. But every mistake happened for a reason. So today I'm here for a bilateral mastectomy. If this fault have not been, I won't be here.
It's all working together,
Yes. It's all work. You all work together. Everything that happened, me, the Muslim, we said, Alhamdulillah, that thanks be to Allah that it happens that way. For someone also to learn out of it. Yes, so that. that mistake will never happen again.
Right.
And then, do you have a
No,
question?
go ahead.
So when you realized that you had breast cancer, when you finally went to the hospital, did you have to change your lifestyle? For example, did you have to exercise more? Did you have to change the way you were eating? Like, what kind of changes did you have to make to stay,
The change that I made was that I have to go to the hospital regularly. The way I was doing the previous years. That's the way I changed my lifestyle. But for breast cancer patients, there's nothing that you can't eat. You have to eat everything because always you have to get fresh blood for your treatment. So you have to eat everything in this world. So as doctor, it's true.
Don't go and eat your food.
No,
They say
but
it's normal, eat
normally,
well.
then you
Balanced
have to,
diet.
you balance diet. You have your fruits and your vegetables added together. In the morning, I have my vegetables with maybe sardine and water, and then my Milo tea with milk, right?
Hey,
And
you've
then
been
I
enjoying yourself. So Raheema, just sitting with you, I think it's very inspiring to see someone who has gone through something as deep and as life-changing as this, and you are still joking about it, laughing about it. But really, really, sometimes when you look at yourself in the mirror naked, you see that, Charlie, my breasts are not there anymore. It's cut off. Or when you think about the pain that you've been through or the stories, like even in as much as you are close with your family now, you basically lost your husband because of this. Do you feel sometimes some anxiety or depression or sadness? Are there sometimes where you are down and it's just like, hey, this life, dear,
My breast pan.
we just.
But me, I'm different altogether, right? That I told you that everything that happened happened for a reason.
Yeah.
So the God who created me said, I will test you. I don't know which kind of test he's going to give me. Maybe this
is a test.
Yes, this is my test.
Yeah.
So when God tested you, you have to stand on your feet and fight.
Right.
So I fought, and now I'm living.
That's cool. That's really, really good.
So whenever I look in the mirror or whatever it is, I became happy because I've maybe direct someone on the right path.
Yeah.
So that's it.
So what happened and you became, I think now I can call you like a breast cancer activist, like you've been speaking about it.
Yeah.
What happened and then you became this person? Because I'm sure before that you were just
Your
living
corner,
your
mind your own
life,
business.
mind your
Yeah.
business. But now you come on shows like this, you come and speak about your experience. I'm sure you talk to women. You say your family has joined you and so on. So like,
She
what
says
happened?
she talks on the church or anywhere. She doesn't
Anywhere,
care.
I don't care.
Yes, it's
If you
good.
said if I should even remove my dress anywhere, I'll do it.
And show everybody. Hey, serious.
Wow. But doctor knew me. I'm Raheema, yes.
Doctor,
that's
is
me.
it true?
That's me.
I really forgot your question.
So what happened before you became this
I was happy
person?
because you became this
Yes.
person. Yeah.
Who will tell everybody about it?
And I don't know how to say it because I think it's the work of God. Yes, because God wants to use me to just let people wake up from their sleep.
Yeah.
But breast cancer is survivable and curable.
Yeah.
But there are some people, they say, hey, I will die, I will die, and will be like bird. But no, you have to wake up, fly away,
Yes.
fight for your rights.
Yeah.
Yes.
Yes, women, we are very, very important.
Yeah.
Yes, for me, I thought it's the work of God
Yeah.
that used me to inspire other women. I always say I am a hero.
You are.
I'm a hero.
Yeah.
And with that, together, we can change the narrative about cancers in Africa.
Yeah.
Yes, we have to do it together.
So the question I want to ask is, since you started this advocacy, that's the word, right? What are some of the things you've seen? Like, what are some of the stories you've experienced? I don't know, people who were negative but are now positive, people who have cancer but they've now been healed. Like, what are some of the things that you've seen in the field?
Sitting down today, I'm an employee at Peace and Love Hospital
Okay.
as a peer navigator, helping other women to achieve their goal. Yes, there are so many people who have been coming in, especially the first thing I would say about it, there are financial problems. That's number one.
Yeah.
And there are some people also, they will come for the chemotherapy, 1st, 2nd, 3rd dose, and then when they are doing much, they say, oh, and this thing problem that I came with has gone, so I won't come for the next
remainder.
treatment again. And they will be back, they will go back and they will be in the house for so many years, or when they will come back with the same problem again. So that time it has reached the advanced stage, right? And there are some advanced stages that nothing can be done.
Yeah.
So that is the this thing that I have for the other women that have been coming. So that is the whole truth. So we women, we have to wake up from our sleep.
Yeah.
Early detection. I said early detection and prompt action.
That's right.
Help you. Yeah.
I appreciate that you added the prompt action, because I feel like you had early detection,
but I didn't
prompt the action. You didn't prompt the action.
Yeah.
So yes, you have to move quickly.
Yeah.
I think we should touch on the financials. I think Doc can help, because I think that's one of the things I always think about. When people talk about cancer, the first thing you're thinking about is chemo. And you're thinking about, it's so expensive, this. On average, how much is chemo? Is it something that is being sponsored by National Health Insurance or not?
Yeah.
Is it subsidized? What's the whole?
I think it's for like age groups and things, right? I heard something like 5,000 CDs per round or something, or per cycle.
Yeah, so guys, we're just asking Doc, and basically you're saying that yes, there's always insurance, like National Health Insurance, which covers stuff, but still you would have to do top-ups. And the top-ups be very crazy. And we are looking at 5 figures and above, right? Always like in the thousands, 10,000s, like and above. And
And the National Health doesn't cover everything.
yes, like the
chemo and the diagnosis and some of these things. So
yeah.
you have to pay something. There's no two ways about it.
And let me bust your brain, guys. I think majority of hospitals, please correct me if I'm wrong, they do like the screening for free. So just go and let them press your breast for free.
Especially in October. A lot of people do free.
It's free.
Who will do it, yeah.
An experienced hand is the difference. So go to your doctor or come to me.
So obviously,
I beg you, please go to the hospital.
I really panic. So the rich auntie vibes, please attach your mammography to it.
Yes.
As you are growing older, make sure you do your mammography and ensure that everything is on point there. So Zu, do you have any questions, anything on your mind for now?
Yeah, so you said you work with, was it Peace and Love Hospital? Yeah. So generally in the healthcare space, do you feel like hospitals are doing enough to help people who either just got diagnosed with breast cancer or already have breast cancer? Like, do you feel like the hospital is really helping them?
I mean, I will talk about Peace and Love. That's where I work.
Yeah.
Because normally, doctor is doing very, very, very good for the woman. The way she helping her is also helping the same women all out. But for her, she doesn't want any woman breast removal. Although it's a surgeonist and the doctor. Yeah. You also want to help us out for us to be free for good. So she has been helping us very, very. In our hospital, always free screening, no charge. So any woman who wanted to be screened, if you come to Peace and Love Hospital, Spinters here, and we have our head office in Kumasi. When you pop in, your breast will be screened free.
Free.
No charge.
Yes. That's the best way.
We doesn't wait for October. Always free.
That's right. That's good. And then what advice would you give to people who have just been diagnosed with breast cancer? Because like you said, for you had certain family members who they didn't understand, they were scared, they left you. And obviously those people will be going through, they'll be sad, they'll be depressed, they'll be so on, they'll be scared. What advice would you give to certain people like that?
For me, sitting down here today, I always like all the women who have breast cancer or whatever it is. 3, 4, omo can say, "Ntuma ekatanema bebreso." Enye yenu funku. Now, what I'm doing today, no one is asking you to come and do it, but just come in and have your treatment and survive and use your tomato to cover it. That's all. So please, women, I'm just advising you people to come out, fight for your rights.
Yes.
Please, women, you are very, very important. So come out and fight for your rights and survive. Don't hide it. Please.
You see, what I
Thank
appreciate about Raheema is that it's like this is not something to play about. Like in as much as
business.
it's scary, you are anxious, you are afraid, like, hey, what is going to happen? Like, time no day.
Yeah.
You have to move quickly. Just
Yeah.
move quickly. And in as much as like it's very valid for you to be scared, it's very valid for you to feel like, hey, what's next for me? But the moment you found out that there's something weird going on in your breast, just move.
Yeah.
Get to the hospital, see what can be done, see what cannot be done. If you are going to do GoFundMe, like just start moving, because if you are sitting in the house and you're afraid and you're not moving, I feel like from what we've learned today,
Your time is ticking.
the cancer is just growing faster and faster and faster and faster. It's not going to make it any
And the bigger
better.
it becomes, the bigger your money will be bigger. When you come early, your
Actually.
money will be small.
It's true.
So come early
Yes.
to save your money.
Yes.
Oh.
That's right.
True.
That's right.
True.
That's so
True. Yeah,
Yeah.
I think for me, I also want to talk about the fact that I just think in Ghana, I think things are changing, obviously. People are getting to know about breast cancer and the awareness is there. But just generally, I think we have this, I don't even know how to explain it, but it's some kind of conservativeness that's honestly, to me, they make sense. It's the same with it. I think it just streamlines along women's health
Yeah.
when it comes to going to the gynecologist, when it comes to like going for a breast screening. It seems very, it's for people who are married or people who are old. Even like as a young girl, if you say I'm going to the gynae, they'll think that you are going to either do an abortion or you have an STD or something bad has happened to you.
Yeah.
But this is basic, like
Healthcare, yeah.
basic healthcare that every woman should know. By the time you hit adolescence and your uterus has started working and you are seeing your menstruation, you are a woman now and you should be able to go to the gynae and have like a conversation with your gynae and be free. But that's not the case.
Yeah.
Do you get it? And I think like we are talking about breast cancer today. I'm sure we can talk about endometriosis in the future and all these little things are not little, but like big things that seem little because nobody talks about them. Nobody is going to the hospital. So for me, I just want us to touch on that. I feel like I don't even know how to say, like the information barrier is too much. And then availing yourself for a doctor to examine your breast seems like such a forbidden thing. Hey, some man be that I don't know is going to be in the room with me alone and press my, like, guys, I don't know. So what do you think? What's your take on this?
Yes,
Raheema?
yes,
So what's your take?
I agree. I agree with you because, like you said, I think it's a cultural problem. There are some things, especially surrounding the private parts, as people call them. If it's private, then it means, hey, I don't know, there's some fear attached to it. So people don't even want to go, even they go to the hospital. I mean, it's normal to be shy and stuff like that, but people will even lie to the doctors. They'll say, have you been having sex? No. You know, that question is what will save your life. So please.
Actually,
We
because
need
they
to,
treat you completely differently based on in
but
a
I feel
positive way.
But I
though.
feel like the doctors, they know that you're lying, so they will catch you. They know that you're lying.
They'll just say, anyway.
So yeah, I think we really have to change the way we approach some of these things. Yes.
I think so. I really think so.
Yeah.
And especially the students, the university students. Most of them. Last time we went to KUSC for screening. Do you know what they said? Those people, what are they coming to do here? Those people over there.
Oh wow.
Meanwhile, they have breast.
No, meanwhile they are allowing some random
So the
university boys to breast their
students,
breast. They don't
students.
let the professionals check for them.
No. We said those people, what are they coming to do here?
Oh
They
man.
were just passing and you know how they have been working up. Like those people, what are they coming to do there?
Yeah.
Wow.
So Doc has seen a 13-year-old diagnosed with breast cancer.
Bilateral.
And it was in the two breasts.
Yeah.
And both of her breasts literally cut
Yes.
off. That's crazy.
Birth.
Wow. That's serious. That's serious.
So what happens now that you've said pregnancy? So if you have breast cancer and then they've taken off both of your breasts, what happens with respect to breastfeeding? I just have to ask. Yeah,
Yeah, you can't.
you
do
can't.
this.
The formula.
Yeah.
Oh wow.
Can't do it. Yeah, so me, I also want to say, like you mentioned earlier, to the men,
Yeah.
come on, guys, come on. If you are there when the breast is there, you have to be there when the breast is not there.
Yeah.
It's not that the breast is gone, then you go. You have to stand up, and I feel like if you are enjoying the thing when it's there, it's your responsibility to also be there when the times are hard. You know,
100%.
Yeah, so
I was literally
and men
about to
also
say that.
get breast
and men
cancer.
also-
Yes,
And I think yours is even more complicated because you don't even have some breast tissue for. I don't know. I'm not a doctor, but I feel like if you have more breast tissue, the cancer go feel enjoy itself in the tissue. But if you slack right now, to enter your bones and your. Am I right, doc? It's more aggressive. Yeah.
But,
It has really.
wow.
This is a very like enlightening conversation for me.
Yeah. So I think also everyone watching needs to learn. If you go on YouTube or wherever, I'm sure you can see tutorial videos on how to scan or to what's the word? Is it scan?
Self-examine.
Examine your
You have to raise your hand.
yeah, self-examination.
hey, guys, we learn it's
You
possible.
can learn how to do it yourself.
Yeah.
But again, like we've all been saying, you still have to go to the hospital at least.
experience
How
hands.
often? Yeah, okay, every 6 months.
In October, just go.
Yeah.
But
yeah.
remember, the cancer is not waiting for October.
Yes. So at least twice a year or every 6 months. Please go and
I haven't done it in a very long time. So let me just
you have to
report
do it.
myself. So
you have to
yes,
do it.
immediately from here,
Yes.
I'll let doc check
No.
before he goes to the office.
He's always ready. We will do our job anywhere we are.
Yes.
That's good. That's
so
good.
that's it. We are Peace and Love Hospital.
Yes.
Hey, she's doing her promo.
That's right.
Yeah, that's right.
No, feel free because it's a good promo. So if you want to
Yeah.
check your breast for free, like
Especially
you
those who are living in Spintex, go to Peace and Love.
Yeah.
We've told
Yeah.
you.
said, in Kumasi,
Exactly, we've told
Yeah.
you.
peace and love.
Yes, we've
Yes.
told you.
And you see me a complete woman now, right?
Yeah.
It's a silicone. When you say silicone, it's really at the artificial breast
Yeah.
that I use that make me a complete woman. I wanted to remove and show it to you that I'm not here for a lie, but I'm saying the truth, right? So I'm removing the artificial breast for you people to see. Yes, I want to prove to everyone. One, and then two.
Wow.
Yes, this artificial breast make me a complete woman.
That's right. I think there's no better way to end this. I think it's been a very insightful conversation. I've learned so much. And yes, like we've been saying, I'll say it again. Go and check your breasts.
Very simple.
Yes, we're
And
in
if you
October.
find anything abnormal,
Yes.
go to the hospital.
So
Yes.
Just go and get it sorted out before it becomes too late and too expensive.
Yes.
Yes, Charlie. I
Early
think
detection.
it saves lives.
You said
And
early and prompt action.
action.
That's right. Early detection and prompt
prompt
action.
action saves
Saves
lives.
lives.
Yes.
Okay. So I think we are actually at the end of the episode. I
Yeah.
don't know, Raheema, do you have any shout outs? Is there anybody who is watching that you want to say hi to? Anybody you'd want us to speak to as well?
well, I don't know whether doctor is looking at me, but doctor, I said hello,
Hello.
Dr. Abna,
Yeah, Doctor.
Dr. Biti Shafi.
Yes.
Yes, all the people in Peace and Love, and then my family too. Oh,
And shout out to Dr. Abina. She's the one who suggested that you come on the show.
Yeah.
So
so
shout out
Dr.
to you.
Abna, hello,
She's here.
I'm here. Yes, you know, this is me, Raheema. Yes, that's me.
So we have to ask Raheema what she's been listening to. What song have you been listening to recently that when you hear it, you're excited?
I have my special song that I can sing.
Oh,
Okay.
feel
If
free.
you people, you allow me.
Okay.
Oh, sing.
I have free the life of sin, this world I'm living in, and I should down for many things I shouldn't do. I have struggled along the way, you could tell me where to stay, where I could find a new happiness, always true. Oh, I crossed the bridge, there's no more sorrow. I cross the bridge, no more pains, the sun will shine, I cross the river, and I will never be unhappy again.
Wow. Amazing.
Okay.
Amazing.
Wow.
Amazing.
Raheema, I understand why we had to interview.
We have to,
I
yeah.
understand.
I'm very happy we did
I
this.
understand
I'm very happy we
everything.
did this.
Yes, so thank you so much for joining us on Stay by Plan. We've been educated, we've been inspired. Your
Yes.
positive energy shows that there's life after surgery.
Yes.
Even if you lose one breast,
breast.
2 breasts, there's life after surgery. It doesn't change anything.
You have to move on.
You
move
have
on,
to keep
move on.
moving on. So Raheema, thank you so much. I mean, it's late. You are here recording with us. That means you have the passion. You know how important this conversation is. And we appreciate you for coming through and inspiring us. God bless you. God be with you. May He continue to give you good health and long life and continue to make you the warrior and the hero that you are in the breast cancer community.
Yes.
And through you, I know so many people's lives are going to be changed. And through this episode, I know so many people's lives
As
would
always,
be changed.
yeah.
So yes, thank you so much for joining us. And yes, I think we are signing off now.
You said
So,
it
yeah.
all, so yes.
I said it all,
You said it
literally.
all, you said
So
it
follow
all.
Stay by Plan
Yes.
everywhere. Check out Peace and Love everywhere. Raheema is also around.
Oh, wow.
Charlie, easy to find.
Yes.
So yeah.
I'm here to counsel you. Come to my office. I have a special office, right?
Okay. Thank you guys so much. Take care. Bye.
Stay by plan, Accra, stay by plan. All the boys, all the girls, for stay by plan. Stay by plan, stay by plan. All the boys, all the girls, for stay by plan.